here's a graphic from early on in the book. It's in the introduction. Okay, so you said, so inflammation is appropriate, right? If we have a wound, or I contract bacterial pneumonia or cancer or whatever it is, the immune system should respond, and it's going to respond in a pro-inflammatory way. There are two sides to the immune system as it's taught in medical schools or immunology. One side is called the innate immune response, and that's the first responders. Okay, so that's the local police. It's kind of how I describe it. Those are things like macrophages, dendritic cells, neutrophils, things like that. So you get a wound or you have the infection, these are the first on the scene. They're going to start the fight right away. Okay, and then you have what's called the adaptive immune system, which is here. And the adaptive immune system is T cells and B cells. Okay, and these take 3 to 5 days to clone out. So B cells make antibodies. T cells are the real assassins of the immune system. So what happens is you have a cartoon hand over here that has a cut. Ow. Okay. So you're going to have a dendritic cell nearby that's going to say, "Ooh, injury," and it's going to take a sample from the wound, and it's going to, you know, say, let's use infection instead. It's easier. So there's an infected wound here. The dendritic cell is going to take a sample of the tissue, and that's right here. This black circle. Now it's red. Okay. So the dendritic cell is going to go to a lymph node, and it's going to go and show it to T cells and B cells. B cells will make antibodies against this target here. T cells have a receptor that match that target, and then they're going to travel back to the site of injury or infection, and they're going to look for cells that match its receptor and inflame against it and go kill it. Okay, so it's going to kill the infected cell, or if it's a virus, it'll kill the cell that's infected with the virus. If it's a bacteria, it'll kill the bacteria. The bacteria is bigger than our cells. So, and then you can get more granular. So depending on where the infection is, when the dendritic cell presents this in the lymph node to the T cell, this is a naive T cell. You see the 0 there. So this is a baby. It's chubby, got cute little wrist lines, ankle lines, chubby legs, cute but useless. Okay. It needs to mature from a baby to an adult. And when it's an adult, it'll be a lawyer or a doctor or a contractor or whatever the different jobs are. Okay. They all do different things. So let's clear that up. What determines which way it goes are the chemicals in the environment, Niraj. So these things that you're seeing on the lines. Okay. So these different cytokines, they're called cytokines or chemicals, are information telling this baby to mature into this job or this job or this job. So depending, you said what inflames someone, depending on the type of inflammation, there's different cytokines in the environment, and it tells this baby to mature into this type of T cell to go deal with that type of inflammation causer. Okay. And so, for example, interleukin 12 will promote a Th1 cell. Those are our main antiviral and anti-cancer cells, our anti-infection cells. And interleukin 4 will drive this to a Th2. That's sending it to mucosal barriers, gut, lung, sinus, bladder, allergies, mold, pollen, parasites, that sort of thing. Th9 is the same thing as Th2, but more intense. So you're going to have a greater kind of histamine type response there. Th17 is mucosal barriers, similar to that, but also this drives the tissue damage seen in autoimmune disease when inappropriate. Th22 is a high inflammatory response. T follicular helper cells, this is a big antibody response. And T regulatory cells quiet it all. So these are the anti-inflammatory, tolerance, calm down, tolerate that, don't overreact. So depending on the combination of these different cytokines, dictates the immune response and the type of inflammation and what we're becoming inflamed against.